Okay. I think we're ready to kick off. Well, welcome everyone on this, I'm going to say beautiful March day in Scotland. I know where others are coming from, it might not be so beautiful. And this event, the future of endometriosis care in Scotland, co-hosted with Endometriosis UK. And I'm Hannah Bardell, I'm the Member of Parliament for the Livingston constituency up in Scotland, and I think we've got between 50 and 65 attendees from all across Scotland and beyond, I suspect. As we were all living our lives online, we can log into anything. And I'm really pleased to have with me an incredible panel. I am a vice chair of the all-party parliamentary group on endometriosis. And of course, March is Endometriosis Awareness Month. So I know all of us have been talking a lot about endometriosis, and that is not limited to March. Your symptoms and your experiences are not limited to 1 month, and I think we're all very conscious of that. And I'm really looking forward to hearing from people who are with us today as panelists, but also folk who are joining us to discuss these issues. So to introduce you all to the panel, we have Emma Cox, who's the CEO of Endometriosis UK. Hi Emma, thank you for joining us. Andrew Horne, who's a consultant gynecologist and researcher at the University of Edinburgh. Thank you very much, Andrew, you're very welcome. And Brittnee Leysen is a helpliner for Endometriosis UK. She's based in Glasgow and is going to talk about her personal experience as well of living with endometriosis, the impacts of COVID and the impact of delayed diagnosis on her mental health. And the Labour MSP, Monica Lennon, was hoping to join us, but unfortunately, parliamentary business has meant she is unable to. So she passes on her sincere apologies. Many of you will know that Monica's done a huge amount in the Scottish Parliament on these matters as well, but we do have a video from Monica. So I think, before I kick off with Emma, I just want to say, a few words from my own perspective of the work that's been done by both Endo UK, but also the local groups. And I know that there are many across Scotland and the UK, and I can speak, I think, with particular authority, and hopefully some of my West Lothian endo warriors are here. I'm quite sure they are, who are run by Candice and Claire, and they are an incredible group of women who have done such fantastic work locally. And actually West Lothian has just become the first council, I believe, in the UK to fully adopt the menstrual wellbeing programme that they have helped put in place, and that's been just such a huge step forward, and getting these issues on the political agenda and helping people understand is so important. I have 2 members of staff myself who are sufferers, so I know firsthand from them what their experiences are. But I don't want to take up too much time. I look forward to discussing these issues and the impact of COVID, because I know way back, Emma and Faye, when we discussed the report and its publication, and we were discussing whether we should be including COVID in it. And I think at that point, we were only a few months in, we didn't really know what was going to happen, what the impact was going to be. And we all felt very strongly that including, the impact COVID has had on care and delays was really crucial, essentially compounding an already really chronic issue with and challenges with diagnosis and treatment. So I will talk further down the line about the work that the Scottish Government's doing and my own party in government. But first of all, I want to come to Emma Cox, CEO of Endometriosis UK. Emma, over to you.
Thank you, Hannah, and hello everyone. I hope you're having a good sunny day in Scotland. What I was just going to talk about briefly was around what some research from some findings we have from Awareness Month about attitudes towards endometriosis symptoms, and obviously the need to break down the stigma, and some of the impact of COVID, and some work that the Scottish Government are doing and that we're involved in. I should say there is a Q&A function, so if anybody would like to ask questions, if you could add those to the Q&A function, we will get through as many as we can during the session today. Just for those of you, I'm sure everyone does know what endometriosis is, but it's a disease where cells similar to those lining the womb go elsewhere in the body, but unlike the lining of the womb, they have no way to exit the body. I'm pretty sure everyone does know that who's on the call, but just to clarify, if that's not what you're expecting to talk about, do stay anyway. So we did some surveys for some surveying for Awareness Month in February this year, and we found that 80% of 16 to 24-year-olds who experience symptoms of endometriosis wouldn't bother going to a doctor with them, and that's because they would be either embarrassed, they thought that painful periods were normal, they thought it wasn't something that they'd be listened about, or they just didn't really think it was an issue going forward. And I think I think we all know who are here, but one of the great issues with endometriosis is people just not realizing or being made to think that what they're experiencing is normal, or they're being a bit of a wuss. And so one of the key areas we work on Awareness Month is obviously raising awareness, and many thanks to all of you out there who do that so well. We also found that almost half of the female population aged 16 to 54, so 47%, would be concerned to tell their employer they needed to take time off sick due to endometriosis. And this is something that we hear a lot about, which is why we launched the Endometriosis Friendly Employer Scheme, is people at all stages of their career, but especially entry level, going into jobs first time, finding it really challenging to talk to employers around about having a condition that covers all sorts of issues, from painful pelvic pain, periods, potentially bowel issues, etc. And so we have been doing a lot of work and want to raise a lot of profile with employers to ensure that they understand what support they can give to people with menstrual conditions, which aren't nice, clean, one-off incidents, are they? Endometriosis is a chronic condition, and people need support on an ongoing basis. So there's that. So in terms of breaking down the stigma, one of the key things we've been working on, as many of you know, is around encouraging all governments across the UK to ensure menstrual wellbeing is taught effectively in schools, which we think is really important to cutting down the stigma, raising awareness, and just so people know the right words and the right terminology and when to ask for help. And we believe that should be done in a school setting to ensure it's done in a supportive and enabling way. We don't want to scare any young children about having periods, but we do want people to know what is going to happen going forward. There's actually quite a lot going on in Scotland. If I was in one of the other nations, I'd be saying, oh, they're doing a lot better in Scotland, So what the Scottish Government Programme for Government, Scottish Government Programme for Government from 2019 to 2020 did commit to developing a women's health plan, which has been, with the aim of reducing health inequalities that affect women and those assigned female at birth. And so one of the parts of that is that they have a very snappily titled subgroup, which is menopause, menstrual health and endometriosis subgroup, which in fact both Andrew and I sit on. And we've been working with the Scottish Government all year, who are looking to see how they can work through and improve those areas for those with endometriosis. And certainly I've been encouraged about how positive so far the recommendations have been that we've put in. We haven't got the outcome yet, but certainly in terms of recommendations, and those are things like committing to reduce diagnosis time. So as you know, in Scotland, the average is 8.5 years, which is higher than in England. And we believe that the government should be aiming to make sure that by 2025, that's an average of 4 years or less, and a year or less by 2030. And we do believe that's doable. We also believe that as we come out of the pandemic, if we could streamline those services and stop the, almost 60% of people needing 10 or more visits to GPs by diagnosis, stop, 43% needing 5 or more hospital visits, and actually we could help diagnose people early and save the NHS in terms of appointments and other times and misdiagnosis. So diagnosis time down. We want to ensure that there's a minimum baseline for endometriosis diagnosis, treatment and management, and that is actually written down. There's the NICE, National Institute of Clinical Health Excellence guidelines on endometriosis, and in fact our very own Professor Horne was one of the people who helped write that. And so we are calling for the government to, now that it's been adopted in Scotland, to implement it, and that has some great stuff in there about prompt diagnosis, access to people who are trained in endometriosis, etc. We are recommending around, as we've talked about, menstrual wellbeing being within the school curriculum, for employers to ensure that they recognise the workplace. And I suppose the other call out, just from our perspective, is if you know people, or if you're suffering from any symptoms, really do seek help. We get a lot of people at the moment saying they feel they shouldn't be contacting GPs, etc. GPs, their doors might not be open, they're a little bit locked, but their phones are very open and they will want to hear from you. So if you are suffering from any pelvic pain symptoms, please do seek help. I think that's my time, Hannah, so I will be quiet now.
Thank you very much, Emma. That was incredibly comprehensive. And before I bring Andrew in, Britt Gibson has just said we also have great Endo UK support groups in Glasgow, Edinburgh, Fife, Dundee, Caithness, and Sutherland, Scottish Borders and Aberdeen. And I think that's a really important point, that, you know, local groups are absolutely crucial in the tackling these issues and communicating with local communities and folk on the ground. You know, so I believe, you know, government policy is very important, but how it is implemented and how we work with local groups is also just as important. So without further ado, Dr. Andrew Horne, as I said, is a consultant gynecologist and researcher at the University of Edinburgh. So Andrew, over to you.
Thanks very much, Hannah. So Hannah asked me to just briefly talk about the impact that COVID has had on endometriosis care, and I'm sure I don't need to tell this audience that I think COVID has had a tremendous impact, not only on patients with endometriosis, but also on anyone suffering any chronic health condition. I think people have felt isolated and unsupported, and I know that Endometriosis UK, together with the University of Oxford, have been looking at this in a bigger both national and international survey, and at the moment the results of their work is being analysed. But I think in terms of healthcare support, we've seen negatives, and I do also want to focus on some positives, but obviously the negatives have been at the outset of the pandemic, a lot of cancelled clinics, postponed surgery, and that's still ongoing and still a huge problem, and even limited access to treatments. I hear of stories of patients who've not been maybe able to access certain drug treatments from their GPs. But I think some of the positive things that have come out of it, and maybe not everybody would agree with me about this, but the sort of facilities that we've been promoting, which have been things like the telephone clinics, the video consultation clinics, which have come into play much more quickly than they would have done if it hadn't been for COVID. And I think also there's been a lot of online self-help resources that have been put together that I hope people have found helpful during these difficult times. So bearing in mind these things, how are we going to move forward? Well, I think there definitely needs to be some form of national strategy, whether that be across the whole of the UK or within Scotland, to try and look at waiting times, particularly for surgery. One of the problems certainly that we have in our hospital is we have been functioning again as normal. We have our operating list as normal, but they're much reduced due to the fact that the anaesthetists need a lot longer to anaesthetise patients. So we're maybe only having 2/3 of the number of patients on our list. So in order to catch up, this is a real challenge. And I think we need to start looking again at weekend lists, maybe access for the NHS to private hospitals to try and catch up. I was speaking to the president of the RCOG this morning, and he certainly feels very strongly about this, and they're going to be setting up a task force to look at this from their perspective. I also think moving forward, we do need to continue to look at what online resources we have available and make sure that I think this is much more available and accessible to everyone. And I think also we need to make sure that video consultations and telephone consultations continue to be available for those who want them. So some positives and some negatives, but certainly I think a lot of work to be done over the next few months and few years.
Thank you so much, Andrew. That's incredibly helpful, and we can come on to the broader discussion, but I do know that a lot of work is being done. I've no doubt in every government across the UK on tackling those issues around waiting times, and it's one of the reasons that we're not going into the traditional purdah period, you know, before an election where everybody, you know, sort of essentially stops doing anything but essential work. We're continuing on with casework and all of these, trying to tackle all of these issues right up till election day, but very much agree, and I will certainly take an action to go away and discuss with my colleagues in government, as I did, when we were coming out of the first lockdown. I wrote to all devolved administrations to say, look, what's happening? What are we doing about the waiting times, and how are we going to communicate with particularly patients who suffer from endometriosis and have been waiting? And as we come out of COVID, what are we going to do to learn the lessons of what has been a huge shock, no doubt, to many. But I don't want to take up any more time on that. We'll come back to that. But next, I'd like to bring in Brittnee Leysen, who I said and hopefully I've pronounced that correctly, Brittnee, probably not, is a helpliner for Endometriosis UK. So she's usually at the sharp end, based in Glasgow, and she's going to talk about her own experience of endo, but also being on that helpline. So you're very welcome, Brittnee. Look forward to hearing.
Oh, thank you so much, Hannah. Thanks for having me in. I think the sad thing is my endometriosis story is not unique. It wasn't a positive one. It's become better as time's gone on, and I've had my official diagnosis and I'm with an expert team, but it was a long road to get here. So I'm one of those few that also is an 8+ year wait of experiencing symptoms, which started back when I was in primary school and bleeding through pads every hour and tampons, and it was not a pretty sight, not a great experience, and hard to explain to my peers as well as my instructors. And that's something that even today, as a PhD researcher, I still am having a hard time explaining and trying to get accommodations for what this condition puts you through, just like anyone in the workforce right now. So when I went to get my endometriosis diagnosis, it was in 2018 that I finally got a referral through for a laparoscopy. But this laparoscopy was with a general gynecologist who made one incision. I was under for less than 20 minutes. There was no biopsy, no photos taken, was woken up and told, maybe you're just really bad with dealing with period pain and maybe it's IBS, which is something that I'm sure most of us here can relate to who are watching this call right now. And luckily I had a fantastic GP who had been with me for years and seen what I had been going through, knew that my mother had endometriosis that was diagnosed. So that put me in a good position to be able to file a complaint about the way my procedure was handled and get me a second opinion with an endometriosis specialist who 6 months after that first surgery performed a laparoscopic excision surgery because endometriosis was found all over my reproductive organs. So it's one of those things that now I become really passionate about. Anyone who gets told, oh, it's just IBS, oh, go away and have a baby, oh, you're bad with dealing with pain, because you maybe haven't been looked at by the right team. And I think as we look at the future of endometriosis care in Scotland, we do need to make sure that the people who are doing these laparoscopic procedures for diagnosis of endometriosis are endometriosis trained. You don't want it to be missed, because the mental health impact of going under for a surgery and having someone actually cut you open and tell you nothing's wrong with you when that could be very far from the truth is detrimental. And for me, that was detrimental. I am now going through trauma therapy for CPTSD, which involves a few other things, but my journey through endometriosis has definitely had a massive impact on my mental health and my progression through my studies. Something that I had done recently was look into chronic illness in higher education. Throughout a number of our case studies that we had done, there was numerous stories that came forward of endometriosis sufferers or suspected sufferers who were trying to get a diagnosis, but obviously the impact of COVID will impact how quickly that happens. And without an official diagnosis, they were not able to access disability services, which provides you with extensions and different accommodations within higher education as well. So that's something that definitely needs to be taken on board. If you don't have any kind of documentation to prove this is what's going on with me, it's very hard to get anyone to listen and understand. And even when you do have that, it's still very hard to get anyone to listen and to understand. So education is definitely something that needs to come forward. Mental health care, when you get diagnosed and told that you have an incurable condition and you're going to have to figure out how to manage and live with it, you should be offered resources for how you're going to process that, how to talk to people that you're friends with, that you're colleagues with, that you're in a relationship with. We don't have any of that available right now. And that is something that I would like to see change in the future of endometriosis care in Scotland as well. So thanks.
Thank you so much, Brittnee. And, I want to say I'm sorry that has been your experience. It feels like a glib thing to say because what you've been through is so traumatic, but I'm also conscious it's probably very similar to a lot of people. And I know, from those who suffer, the women that I've spoken to in my constituency, it's very, very similar. And I've had representations made to me recently about women locally who are having to self-catheterize, which is just, mind-boggling, and trying to understand how we've got to that stage, but also what we do to to sort those issues out and to try and tackle those. And I think Emma has spoken very positively about the work that the Scottish Government's doing, and that's I hope is going to really bear some fruit and be really positive and exciting. And I think in terms of chinks of light and hope, I mean, the points that Andrew makes, I would say are really important in terms of the positives and the things that we've discovered we can do almost overnight. Everybody had to work from home. We found new ways of technology. So perhaps there's going to be an opportunity that once, as we come out of the pandemic, as we now have dates set in, I'm not going to say stone, but they're relatively strong markers in terms of what we expect to happen in the next 6 weeks to 2 months in terms of coming out of lockdown, is that if we can try and fast track as much as possible and use those extra resources and look at the flexibilities that might be possible in terms of people's treatment and surgery, plus add in all the things that we have learned from COVID, perhaps, although that I can't even begin to imagine how traumatic and difficult recent times have been for endo sufferers, and indeed, as others have said, sufferers of other chronic conditions, but perhaps medium to long term, we're going to benefit from the things that we have learned during lockdown and during COVID, and that there's services will be able to be delivered in different ways. It won't have to all be going to a hospital and seeing people face to face, although I fully appreciate a lot of these services have to be done like that. So I think there is hope, hopefully some positives there. I think we now going to move on to the video from Monica Lennon. So Faye, if you want to share screen and take us away with that.
Hi there, I'm Monica Lennon. I'm a member of the Scottish Parliament for Central Scotland region. I want to thank Endo UK and in particular Faye Farthing for inviting me to contribute, and I'm sorry that I can't attend the full event due to a clash with parliamentary business. Like so many events in our lives right now, this Endo Awareness Month is unlike any other. This time last year, I was proud to host a reception for Endometriosis UK in Holyrood. Little did we know that the country would soon be in lockdown. COVID-19 has caused tragic loss of life and massive harm to our country and our economy, and it has put pressure on health and care services like never before. And for many people living with endometriosis, life has become ever more challenging. And we know that endometriosis isn't rare. It affects 1 in 10 women of reproductive age. We all know that it can be a debilitating condition that impacts on normal everyday life. Research from the BBC last year really struck me. It was based on a study of over 13,500 women, and it found that 94% of those with endometriosis have also suffered with their mental health, and over half, 54%, had experienced suicidal thoughts. At the extreme end, women are dying due to this condition because they're in so much pain and are not getting the right help. So we can and must do better. The impact of COVID-19 on the health service has been significant. There is no denying that. I am the convener of the cross-party group on women's health in the Scottish Parliament, and we have been looking at the impact of the pandemic on women's health. In our cross-party group, women's voices are always present, valued and heard. But can decision makers across governments and the medical professions always say the same? The fact is that it still takes around 7.5 to 8 years for a diagnosis. I think that answers the question. However, that said, we are very fortunate to have trailblazing clinicians and researchers based in Scotland, and we have a very strong network of endometriosis campaigners who share their own lived experience to raise awareness, support others and push for progress. I'm glad that Dr. Andrew Horne will be speaking at the event. It's been great to work with Dr. Andrew Horne on previous work that the APPG has carried out during the course of this Parliament term. We need to keep up the pressure in the wake of the pandemic. As you know, the Scottish Parliament will enter a pre-election recess next week ahead of the forthcoming election on the 6th of May. Progress on new treatment centres during the lifetime of this Parliament has been positive, but there is always more we can and should be doing. The Women's Health Plan being worked on by the Scottish Government Working Group has to be key to this work. And it's my hope that the new Parliament session will have a renewed focus on improving women's health, including endometriosis care. For too long, women have been dismissed or put to the bottom of the pile. I want us to change that. Arguing for more resources and working with experts to improve medical care is one important aspect to achieving change. But there's also lots of work to do in tackling stigma. The Period Products Act, which I steered through Parliament, has gone a long way to reducing stigma in Scotland about menstruation in general, and I'm confident it will continue to do so. Talking about endometriosis openly is important, and raising awareness of the condition is crucial too. I'm proud to be an endometriosis friendly employer. This is just one mechanism we can use to increase awareness throughout the general population. I look forward to continuing my work with Endo UK in the months and hopefully years ahead if I am fortunate enough to be re-elected in May. If anyone would like to get more involved with the cross-party group on women's health, please contact my office at monica.lennon.msp@parliament.scot. I very much hope you enjoy the event today, and I do look forward to continuing to work with all of you in the future.
Fantastic, that was great from Monica. Well, I think we can move now to questions. We've already had a couple on the Q&A, and we had some that were given in advance, and I'll go through those. I think we've possibly answered quite a few of those already. Learnings, what learnings do you think there are from COVID-19 for the future? I think we covered that quite extensively already. And the second one was the all-party parliamentary group report found that diagnosis in Scotland in average is 8.5 years, with, as we know, it's lower in other parts of the UK, 8 years, and what's being done to tackle this. I'm very happy to take that on and follow on from what Emma said. I think I speak on behalf of others in my own party and indeed in government that is at the forefront of our minds. The work that Endometriosis UK has done in terms of the survey is one of the biggest surveys I think ever done on women's health, if not the biggest. So in terms of engagement, it gives us such an incredible basis for policy development and actions moving forward. And I have no doubt that I and my colleagues share huge concerns that women particularly are waiting so long to be seen. And I think the point that Emma makes about getting down to a year by 2030, is a laudable aim, and we want to be central to that. And that's why the subgroup has been set up in the Scottish Parliament, and that work will continue apace. I know that the recommendations are not all yet. Emma might want to say a bit more about that, but we have got a very sharp focus on this, and it's cross-party. And MSPs like Monica Lennon, who's from Labour. I know there are others across the political spectrum who are hearing the voices of women and endo sufferers and want to make real changes. I sit at Westminster, so I'm not in the Scottish Parliament, but that does not preclude me from lobbying my colleagues in government. And Emma, is there anything else that you want to say, or indeed, Andrew, Brittnee, do you want to come in on that question?
I think, Hannah, that's a great coverage. I mean, I know there's a long way to go, but I am really hopeful, and I am an optimist, that the work the Scottish Government doing is really going to make a difference. I think we all recognise that endometriosis at the moment, it does take some time to diagnose because we don't yet have a biomarker, easy test for it. But I do think there's a lot more can be done. I was really struck by one of the things that Brittnee said earlier as well, which is around not having an official diagnosis and then not being able to get help. And I do wonder, and this is for medical colleagues, not me, but I do wonder if there is a way, as we have this long backlog at the moment, of encouraging more, if you like, provision, I don't know what the word would be, provisional diagnoses or suspected diagnosis of endometriosis, so those at school and work at least have a label and can get help going forward. You know, I hate to think of people missing out on work, employment, or whatever it might be, because we've got long waiting lists due to COVID. So I don't know if that's something we could look into as well.
Yeah, Andrew, would you like to come in on that?
Yeah, I think, Emma, that you're making a really good point here, because the laparoscopy, whilst sometimes it is helpful to go away with a diagnosis and then, you know, the treatments that follow. As you know, Brittnee, if you aren't given a diagnosis, and I know in your case that the endometriosis was missed, but if you are someone who has pelvic pain without any evidence of any pathology, which accounts for about 40% of the surgeries that we do, I think unfortunately your care in these situations is, dare I say it, worse than if you actually have endometriosis. And they're a group of patients who we really need to also think about how we can better manage. But I think, just to pick up on your points, Hannah, about the positive things that have been going on in Scotland, I've been involved with some Scottish Government initiatives for about 5 or 6 years, and the first one was to try and ensure that we had 3 Scottish accredited centres, and I'm really pleased that the Scottish Government supported us and pushed to have a 3rd centre in Glasgow, and I think that's fantastic. And I think, as Emma says, also the Women's Health Plan really has been a really positive experience. I'm sure, Emma, you'd agree, and there are lots of really exciting initiatives that will come out of that, I'm sure. So I do feel positive about the way things are moving in Scotland. I just think it's a shame that, you know, the pandemic has really kind of got caught up in the middle and holding everything up, but I hope we can recover from that.
Yeah, absolutely. No, thank you so much for that, Andrew. And I mean, there's 2 further questions that were submitted in advance, which was around what's being done to improve mental health support for those with endometriosis, and what can people expect about waiting times going forward. How will it be ensured that those with endo aren't left behind? And which we've already discussed, but I think it goes to some of the further questions we've had. One that I've managed to respond to from Kirsten Bailey. Kirsten, thank you for that question. I know you're in West Lothian, and you know, particular concerns about suspected endometriosis for 13 years. And I've said, you know, very happy if you want to contact me direct. That's something that I think I can do. And I would urge anybody who is having challenges specifically with, you know, access to services, or not being heard, please use your elected representatives. That is literally what we are here for. We are here to advocate on your behalf when you are not being heard. So please, I would urge you to do that. Obviously, you know, the Parliament's going into recess, but my understanding is your MSPs will still continue to do work and to do casework in the coming weeks. And, you know, Vicky Chapman asks a very good question. When can we expect an increase in the number of surgeries being done? As a support group leader, lots of people have been impacted by cancellations, and it appears to differ depending on what NHS board you're with. And I don't know if there's more that we can, you know, maybe say about that, or Emma, with the group, in terms of the discussions about, as we come out of COVID, the waiting times.
Yeah, I mean, I think certainly in Scotland it would be good to maybe have a sort of national strategy, because I know in Edinburgh we've managed to to go back to routine surgery, although we're still very far behind. I know in Aberdeen they still haven't started surgery for endometriosis. Sorry, I use the term routine surgery, and that's just a term that we use rather for non-cancer surgery. And I know it's not routine for people with endometriosis, but so in Aberdeen they haven't gone back to non-cancer surgery, and I think in Glasgow it's still the same, certainly within gynecology. So as the person who posed the question has said, it does seem to be still very postcode dependent as to what's happening. So it would be helpful there. I suppose ultimately it probably depends on the trusts and the funding that the trusts have to maybe run extra lists, maybe buy extra resources in the private hospitals. But I don't know, Emma, in terms of your perspective from the Endometriosis UK side, what you think?
I mean, I think it's the same as I think we all understand why there's a delay, but what is very frustrating for people is not knowing what on earth is going on if people are still on lists. And you know, we've already heard, we know how it's difficult having a chronic condition, but the anxiety of not knowing is really bad. I think what we're pushing for is firstly that endometriosis doesn't get forgotten about, that for people who need surgery they should get the due priority compared to all other conditions, so we don't have this situation where yet again we gets menstrual well-being or women's health is pushed under the carpet. And I think around there's something that we're pushing for, and again it will be up to the medical professionals to do it, but we're pushing is around about priorities. So is it about who's waited the longest, or is it about the people who need the care more urgently? So I think there's that side of things. I think the other thing is some practical tips, and there's a couple of comments about GPs. I will rant in a minute about GPs who say get pregnant, but just not yet. And I think that we are working with Royal College of GPs who are trying to raise awareness of menstrual conditions. They are very concerned that a lot of menstrual conditions, or they see people only mention menstrual conditions in passing. They won't make appointments just for that. They think it's not important, and so they're trying to really raise awareness with their members to encourage people to ask questions when they see people or when they talk to people. So I think that there are things we don't have any questions, and I think there's a lot that is still being looked at. And as Andrew said, I know that the different governments are looking at the different long-term solutions about how can they increase capacity at a reasonable speed to get through people.
I think if I might add, your point about us informing patients is really important. In Lothian, we managed to persuade our medical director to send it's a standard letter out to everyone who was waiting for endometriosis surgery to say, you are still on the waiting list, you've not been forgotten about. And we had a really positive response back from patients saying, that they really were grateful to have received the letter. It doesn't change anything, but I think it was helpful. So I think your point about communication is really important, and I think we could do a lot better with that.
Yeah, because the mental health impacts, as many folk have said, are profound anyway when you're suffering from endo, but to then have that compounded by, and I know that we all understand, but that doesn't necessarily make it any easier. So I think, in terms of the national strategy, in terms of waiting times, Andrew, I will absolutely take on an action to write. I had been thinking about doing another letter like we did before, Emma, to all of the health secretaries and all of the governments across the UK to say, look, what is your plan? What is your strategy? I know that there are times when people are referred out of their area. Obviously, you would rather have your surgery done within your area, but there are obviously ways of managing waiting times, and so I'm very happy to do that and then share that through Endo UK, who can share it with their members and publish online. There was another interesting question there about multidisciplinary teams. Nikki Hartness about the fact that she was saying suffered symptoms from 17 years before being diagnosed with endo, and have had multiple bowel issues from a young age and on various treatments, and that now I've spoken to folk who've had positive and negative experiences, some who've had the different teams speaking to each other and working together, but it seems that again that's not across the board, and often Andrew, maybe you can tell us a bit about that, or Brittnee, if you've got any experience of there not being interaction between those different teams, and that in the centres of excellence presumably that's what happens, but you know, how can we share that expertise and make sure that people are getting you know, a holistic service, I suppose.
Brittnee, do you want to comment first?
I feel like you'll know a lot better than I will, but I think as far as what I've experienced in Glasgow is I'm very fortunate to be under the care of the Endometriosis Centre at Queen Elizabeth here in Glasgow, and I know that does have a multidisciplinary team attached to it. But I guess the issue would be if you're not within nearby one of those hubs. It is the postcode issue again. What about folk that are living in more rural regions? What about folk on the islands? You know, are you getting access to the same team if you haven't already been diagnosed with bowel endometriosis, or if that hasn't been found yet, are you getting evaluated on that multidisciplinary level? And that's something that I think will need to be addressed moving forward. I know we have finite resources right now, but as we develop these plans, that is something that should also be taken into account to have the capacity for that.
Yeah, no, absolutely. Andrew, particularly on you know, best practice and how that's being developed within the medical profession, is this something that's been really pushed by yourself and others?
Yeah, so it was very much pushed in the NICE guideline, which Emma referred to earlier. And certainly, Brittnee, as you say, if you within the centres, but there are only 3 centres in Scotland, we very much have a multidisciplinary approach involving colorectal surgeons, urologists, pain medicine, and usually supported by a specialist nurse, who of course is crucial to the whole, you know, kind of bringing everybody together and making sure everybody works together. I think the challenge here is, as Brittnee said, is we do have finite resources, so we can't have this set up everywhere, but it's about making that setup accessible and making people aware that they can access it. So Emma and I talked a bit about something called a managed clinical network for endometriosis. I'll maybe hand over to Emma to talk about this a bit more, but I think this was something that we have talked about with the Scottish Government, again, so that people are joined up across the whole of Scotland and are all working together, you know, whether it be remotely, and will channel people who need it into the centres where these sorts of resources are more accessible. But Emma, do you want to comment on the managed clinical network?
Yeah, I mean, it's a long word, but for a great actual idea, I think. So this is again something in the NICE guidelines, and it happens for other conditions. And it's basically, it divvies Scotland up into 3 areas, and then, you know, and with a specialist endometriosis centre in each, and then coordination between the specialist centres and the general gynecologists in the general departments. And so that there's, if you like, that cases that need to be can be referred up. There's pathways for people to talk to others if they need to coordinate, and there's some of the stuff we've just heard about in terms of access to multidisciplinary teams. And certainly I've seen in other parts of the country, people are starting to pilot, for example, outreach, where you might have a specialist nurse or a consultant who might go from the centre out to certain times to one of the other hospitals. Also, you might have doctors that learn by going to the specialist centre, so they've got some expertise. I won't bore you with going into the...
No, I think that's really, really helpful, because I think, you know, as Brittnee makes a very good point, you know, Scotland has a particular set of challenges around geography. You know, yes, most of our folk are in the central belt, or they're in the larger conurbations in the northeast of Scotland, but you know, we've got people all over Scotland living in very small rural communities, and you know, the way people are living their lives now is changing, right? And a lot of people are going to probably look to live more rurally and move out, and that's a great thing, but how we deliver healthcare is going to be a big challenge. So understanding, you know, what political pressure needs to be put on in terms of, you know, and working with the centres, because I think that's a brilliant idea that you know, people will be able to go to those centres to get specialist training, and equally go out to smaller communities where they don't have the expertise, because you know, it is obviously impossible to have expertise in everything everywhere. Folk, I'm sure, recognise that. But I think the point that, you know, Deborah's made this point, Claire Kirk's also made a point about referral system and her experience, which sounds awful in terms of the laparoscopies that she's had. And I don't know whether, Andrew, you might want to pick up on that. But Emma, I know you'll be keen to talk about the point that Deborah raises, and I think somebody else raised it as well, about, yes, Abby Fraser-Davidson raised this as well, been told numerous times by GPs and gynecologists that getting pregnant will cure endometriosis, which is totally outrageous. I mean, I thought the work that you did at the beginning of the month, putting that out there and just highlighting how ridiculous it is that people are being told that, you know, just goes to show sadly the level of ignorance amongst some in the medical professional. And of course we're incredibly grateful to our doctors and medical professionals, but to have that level of ignorance and you know, women being told that just seems really upsetting and completely unreasonable. Emma,
sorry, Emma, carry on.
I mean, as you know, I get really, really annoyed when we hear that, oh, you should just get pregnant to cure your endometriosis, because A, it's not true. B, some people actually have worse experience while pregnant. And C, it's quite insulting to someone who might be having fertility issues to tell them to get pregnant, and all other sorts of things.
Not want to get pregnant as well, you know, yeah. That's the other thing. Not necessarily everybody wants to have children.
Exactly. So on every level under the sun, it's wrong thing to do. And Deborah and Abby, I'm really sorry that that's happened to you. What I would say is, I think being very clear, saying they are wrong, that isn't true. There is work that the RCGP, Royal College of GPs, have done. There's a menstrual wellbeing toolkit online. There's an endometriosis e-learning module online. And seriously, I would be tempted to say, have you looked at these? You know, have you thought of doing that? And the other thing I'd just say is that if you are speaking to GPs, and not everyone is in a big practice, but if you have a practice with more than one GP, ask the receptionist or the practice manager if any of the GPs specialise in women's health. Because not all GPs have to know a massive amount, and some specialise in different areas. And, you know, talking to some of the really great women's health GPs, they say, we don't really know about men's bits, we just do women, you know, we'd refer men over. So I think the thing there is do ask, and also you're entitled to have a second opinion going forward. I say the other thing, either Abby or Deborah, is drop us a line and we can always do a letter, you know, or make sure we've got something on our website that you can print and show them, or something like that as well.
Andrew, do you want to come in on that as well? And
yeah, I mean, I think you know, Hannah, how strongly I feel about that. I spoke to Fiona Stalker on the BBC about it last week, I think it was. I think the only thing we can do is keep talking about it and try and dispel this myth. I agree exactly with what Emma said. You know, it's not true. It's completely unhelpful. It's insensitive, and it's you know, it's historic now. It's not something that we should be telling patients.
Absolutely, absolutely. There's another really good question from somebody anonymously around, are there existing general guidelines for aftercare post-diagnosis, or are there plans for future guidelines as part of the Women's Health Plan? While my hospital care was great and some of my endo removed, I had no follow-up or aftercare, and that just seems, you know, I'm quite surprised and shocked by that's not something that seems to be in place, certainly for this person. But is that something that's being discussed, Emma, as part of the Women's Health Plan?
We have touched on it, yes. I think it's for me a massive oversight, which is that, and I know, you know, there's only a certain number of things we can do, but quite often endometriosis, rather than being treated like a chronic and ongoing condition, it's treated like well, you've had surgery, you're done now. And we know that's not the case. And, you know, and I know of people, this is not a Scottish example though, you know, I know someone quite recently who had to have a hysterectomy at 30, and their ovaries removed, not just because of endometriosis, they had other conditions, but as they were leaving that women's health team at hospital, someone said, we won't be seeing you again then, will we? You know, and there's just no follow-up for these things.
What a thing to say to someone.
I know. Anyway, I think there's a real opportunity. So, you know, I think there's some great pathways in the NHS where people have surgery and then they're followed up. And that's everything from, you know, if you have a knee operation, you'll get physio, or if you've got had cancer surgery on your bladder, you'll get followed up to see if you need to self-catheterize or whatever. But I do think it's sort of the next stage of where we absolutely need to go is about having a pathway for endometriosis, not just a one-off. And then I think, and Brittnee, I know we've touched on this before, is almost like you've had your surgery. If you get symptoms again, you almost have to fight to go back to somebody because like, well, you've had endometriosis. So another one I can rant on about, but it's definitely one of the things that we've raised. And I think as we get a baseline for caring, what we've asked is we've asked a couple of things to the National Institute of NICE, the guidelines who produce them, and one is to have, well, three really. One is to having ongoing care, not just one-off care. Another one is to recognise thoracic endometriosis, because you can get it outside the pelvic cavity. And the third one is to improve the guidance on access to pain management, which is quite lacking for endometriosis in a lot of parts of the country. Not at specialist centres where they have excellent services, but elsewhere.
Yeah, I mean, and it's interesting, just somebody coming on there saying that they're, you know, this is a real trigger for them. You know, they're currently pregnant for the first time after a long time of trying and having to resort to being in a menopause beforehand and then going down the fertility route, and they've had no relief from their endometriosis during their whole pregnancy. So that just really makes the point. And Tara, thank you for your comments and question. Tara's 18 and at school, and when she menstruates, it's hell. She's been waiting for a laparoscopy for a year. I want to know what schools can do to help women. I get tested for my body image and over-exaggerating pain and having to run out of class to throw up. Please help us at school in current circumstances. It's so isolating. Tara, I'm so sorry to read that. That is absolutely horrendous. And, you know, Brittnee, you can talk, you know, to that perhaps a bit, as can others. But, you know, I think that's why the education piece is so crucial. It's so crucial.
Exactly. I think that especially chronic illness in education is something that is under researched, but also it's not given the time of day the same way that other disability is sometimes. I mean, obviously all of it needs an overhaul, but I think that was one of the things that came out of the research I'd done in higher education settings in particular, was that students with chronic illness were not being asked what would help. There was almost an assumption of, okay, you have chronic illness, so we think all of you need access to the toilets when you're taking an exam. But there's so much more to it. If you're needing to take time off school, then you're falling behind in assignments and you can maybe get a chunk of time off, but what they don't understand with chronic illness is that you may have 2 days out of that week that you're in absolute agony and you can't do anything, and then the following week you may be okay, and then the following week the whole week you may be off. So those chunks of time don't really work with chronic illness. So it's, again, talking to students who have chronic illness, what would help you? I think they need to be involved in the conversation from the get-go instead of just that kind of presumption of what needs to happen for them.
Yeah, and perhaps endo accredited schools as well, and local authorities, as well as, you know, businesses and workplaces, because, you know, sometimes, and periods are starting younger and younger as well. I mean, perhaps, I don't know if that's part of evolution, Andrew. It's an interesting question, but I know that there are, you know, sometimes children in primary school getting, you know, girls in primary school getting their periods, and so we say we don't want to scare anybody, but also understanding what a normal period is and what an abnormal period is, and what might, you know, what the issues might be around that, and educating boys as much as girls. You know, it's not just a women and girls issue, you know. Emma, do you want to come in on that? I know we've got about 5 minutes left.
Yeah, I won't talk for all 5 minutes. We are really keen to do more work to try and get menstrual wellbeing included in the school curriculum in Scotland. As I say, it has now been agreed for England. We've got some hope in Wales around it being taught as our HSE, but it's certainly something. And Tara, your experience is just horrific. I'm really sorry about that. And so for everyone listening, is we are going to be starting to push again to make sure that menstrual wellbeing is included. I'm sure Hannah and Monica will be helping us with that. But Tara, if that's something you'd like to be involved with as well, to share your experience, it can be anonymous. It doesn't have to be publicly. It'd be you know, it's something we will be taking forward to do that. And I think, you know, that there's just some basic things, isn't it, about saying, you know, period pain might be common, but some people's period pain is more severe, and it could be something else underlying. You know, some quite basic things that we need to get over to teachers as well as to people at school.
The scope is there. I mean, there's not actually any impediment, you know, and a lot of schools do this anyway through the curriculum for excellence, and the flexibility of that allows for it. But I would absolutely agree there needs to be a more, you know, I say blanket approach, but pressure and push to make sure that's happening in all parts of Scotland and in all schools. Andrew, do you want to come in?
Yeah, no, it's just on a positive note. You mentioned Candice and Claire from Endo Warriors West Lothian. They've actually fundraised, and they've come to us at the university, and we're now working with an animator to produce a small sort of little film for school children, mainly sort of early secondary school for that we're going to circulate to Scottish schools. So watch this space. So we've currently worked out the script for it, and it will be something that I hope will help, particularly the experiences that we've heard about already. That's
really wonderful, and yeah, they're an incredible group of women, the West Lothian Endo Warriors. They really are, and you know, hopefully that's the kind of, you know, creative out of the box thinking that can be used and rolled out across Scotland and beyond. I would just invite, we've got 3 minutes left, if everybody would like to make just some brief closing remarks. Brittnee, will we start with you?
Oh goodness, I mean, anytime that these kind of events go ahead, you just walk away so impassioned and empowered by seeing everyone else's stories that are so similar to yours, and that this has been going on for many, many, many years. But I think the main takeaway is that there is progress being made. There are people in government, in the medical community, you know, on the ground, who are doing active work daily to try to make things better for us and for endometriosis. So I know I'm very encouraged and enthused by everything that I've heard that Andrew said, that you, Hannah, and you, Emma, have all put forward in the work that's being done. So many thanks for that from all of us who are sitting on the sidelines, hoping that things do get better and move ahead for Scotland in particular. Thanks.
Thank you, Brittnee. Emma?
I think, to echo Brittnee, I think for me, it's been such a difficult year. There's so many people who have had delayed surgeries, etc. But I do feel that there's sort of longer term hope in terms of raising awareness, making sure that the Scottish Government do enact the things they're saying in the Women's Health Plan. And I think if we get that, and for all the people, so many people who've been involved in campaigning and lobbying and pushing and raising awareness, we need to keep on doing that so that we do get to a state where the diagnosis time is a year or less by 2030, and everything else around that, so that we've got improved systems going forward.
Thank you so much, Emma. Andrew?
Yeah, and just to echo Brittnee and Emma, I think it has been a really tough year, and it's so hard living with a condition like endometriosis, but I do think things are changing. I think we have to be positive. I mean, the very fact that, Hannah, we're sitting with you today, we've had the video message from Monica, I think is just fantastic. And the fact that we can do this now remotely as well. And the main thing is just to keep talking about it, keep speaking up, and keep campaigning.
Yeah, absolutely. And I would just echo all of those words. And, you know, I would say to folk, you know, your voices and the power that you have and the agency is really powerful. You know, you have made politicians like myself, like Monica and others, sit up, take notice, and want to be part of change. You know, it has been an incredibly tough year, and I recognise that. But I hope that we will be able to take some of those positives and look at what, you know, that we can accelerate the work that we're doing from what we've learned during the pandemic. And I think we will. No longer will we always have to all be together in the same room to discuss these things or travel great distances. We can do it at the touch of a button, and that actually means we will be more effective. But I recognise there is still a long way to go, and that we have to, you know, hold each other and our politicians like myself, those who are in power, whatever that is, to account, and continue to press. And I think also, just finally, I'd like to pay tribute to Fiona Stocker and folk within, journalists within the BBC and other news organisations who've spoken out so passionately about their experiences. They have made a huge contribution as well, and have really helped shine a light on the many issues that endo sufferers face. So we will continue on to fight until you have got the services, and certainly for as long as I'm elected. And we will work cross-party, and I think we need much more of that on many issues. But this is an issue that really does transcend party politics, and I think you have support from across the board, and you will continue to have that. So thank you everyone for your participation today. Thank you for all those who've attended, who've shared your very personal and painful experiences, and thank you to Emma and Faye and Andrew and Brittnee for coming along and for facilitating.